Hello everyone. Welcome back to a new quick review. We are going to talk about the pericarditis. This is a high GL topic related to the step 1, and this is a high GL topic related to the step 2 CK as well. Remember, if you are able to prepare really well the step 1, the step 2 CK is going to be easy. Now, we are going to talk about today pericarditis. All the time, when you have a patient with pericarditis, you need to think about a flow chart. That flow chart is a patient with a pericarditis is able to get a pericardial effusion. Pericardial effusion. And after the pericardial effusion, we are able to get a cardiac tamponade. And after the cardiac tamponade, we are able to get a constrictive pericarditis. So a patient with a problem related with a pericarditis is able to reach the problem until constrictive pericarditis. So we need to be careful with this kind of patient. We need to make any intervention in the patient with the pericarditis to avoid any complication related with the constrictive pericarditis. In the constrictive pericarditis, we need a surgery that we call pericardiectomy. So, what is the pericarditis? Here in USA, the principal problem or the principal situation related with the pericarditis is the infection. And mostly of the time, that kind of infection is related with the viral infection. And the second option, when we are in front of a question in the step 2, in the step 1 or the step 2 CK, is the uremic syndrome. Okay? So, the principal situation related with the pericarditis is the viral infection or uremic syndrome. So what is the principal symptom that the patient with pericarditis is able to show us? The principal symptom I try to show you as a 3-piece. It's a positional pleuritic pain. The principal symptom is the chest pain. And when you are in front of a patient that you think that the patient is getting a pericarditis, try to figure out if the patient is getting the 3-piece. It's a positional pleuritic pain. And how we are able to evaluate the patient with the pericarditis? There is a principal test to evaluate the patient with the pericarditis, and that test is the MRI. But not all the time we are able to get in the hospital an MRI. So we are able to get at the beginning the EKG. And what we are able to see in the EKG in a patient with pericarditis, we are able to see 2 principal things. Those 2 principal things are the elevation of the ST segment. But now you can say the infarction of the heart is able to show us as well an elevation of the ST segment. Now, the principal difference between the infarction and the pericarditis is that the infarction is going to show us an ST segment elevation just in a portion of the EKG. But now, the pericarditis is going to show us an elevation of the ST segment in all EKG. D2, D3, D1. In all derivatives, you are able to see that the ST elevation is present in all derivatives of the EKG. That's the principal difference between the ST elevation in an infarction to an ST elevation in a pericarditis. And the another principal point is that the EKG is able to show us in a patient with pericarditis that the PR segment is decreased, is depressed. So we are able to find in a patient with a pericarditis ST elevation in all derivatives of the EKG and PR segment depression. Now, what is the principal option to treat a patient with pericarditis? The principal option to treat a patient with pericarditis is the NSAID plus the colchicine. This is the #1 option in the test. It doesn't matter, step 1 or step 2 CK. It's the first option that we need to pick in a question related with a patient with pericarditis. But now we need to remember that we have some side effects related with the NSAID, and we have some side effects related with the colchicine. The principal side effects of the colchicine is the diarrhea. If a patient is getting a lot of diarrhea after the dose of colchicine, we need to stop the use of colchicine. So the colchicine is related dose depend of diarrhea. Now, the NSAID is related with the peptic ulceration and is related with thrombocytopenia. If we are able to see that the patient is getting a really dangerous levels of thrombocytopenia, we need to stop the NSAID. And the another point is that the NSAID is contraindicated in patients with CKD, chronic kidney disease. So if we are in front of a patient with CKD, or we are in front of a patient with a really dangerous thrombocytopenia, we need to stop the use of NSAID. There is a second option to treat the patient with pericarditis. That second option is the steroid. Okay? But when we are going to give a patient a steroid to treat the pericarditis, we need to be sure that we already are not able to give the patient NSAID plus colchicine. Remember, the steroid is the second option. But there is a big problem with the steroid. The steroid show in many research that the steroids increase the recurrence of the pericarditis in the patient. With this quick review, we are finishing today a topic related to the step 1 and related to the step 2 CK as well. Thank you so much, everybody. Please give us a thumbs up and follow us as a doctor in USA. Thank you so much and take care.